I'm now going to demonstrate examination of the wrist and hand in the context of a closed injury. This is, in other words, a patient who has fallen or injured the hand in some way but not wounding it. So the concentration is on possible damage to bones and ligaments and dislocation of joints. So again, we will assume that we have the patient's consent, and I will examine only the potentially injured hand. Can you tell me if it's tender anywhere? Does that hurt you?
No, it doesn't. No, it doesn't. No. 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 No.
Okay. But can you bend your fingers down for me and straight out? And can you bend your wrist this way and this way? Okay, thank you. I'm just going to do some particular maneuvers here. Tell me if this is painful. Does that bother you? Okay. Does that bother you?
No.
Will you try and hold your hand there, and I'm going to try and twist it round.
Okay.
Does that bother you?
No.
Okay. Just relax. And does that bother you?
No.
Okay. Right. Thank you very much. Right, now let's do that again and explain what we were looking for. First of all, obviously with any injured or diseased structure, the first thing you do is look. So I can see no swelling, no bruising, and no deformity of the wrist or fingers. Now I'm going to palpate for tenderness over any potentially injured joints or bones, checking obviously very carefully that you're not causing the patient any pain. So you feel the radial styloid, which is very commonly injured, and the ulnar styloid, which may have an associated fracture. You check for tenderness along the joint line for a wrist sprain, and you check in the scaphoid fossa here for a scaphoid injury. You can also palpate the two poles of the scaphoid here and see if you can elicit pain by compressing the two of them in here. Those are the common wrist injuries. The finger bones, the metacarpals, are usually broken if they're going to be at the neck of the metacarpals here, but you can certainly feel the whole of the length of the metacarpal. If necessary, they are subcutaneous. Dislocations occur at the base of the fifth metacarpal here, and small pull-off fractures are common in the dorsum of the carpus here, the triquetral. Injuries are common, obviously, in the fingers. Feel for tenderness. And also look at the tips of the fingers end on. Normally, the tips of the fingers form that nice smooth curve here. If one of the fingers is clearly twisted or overlapping, then you have an injury to that finger. If you are worried about these fingers, you can obviously test them individually. The same with the thumb. Now, when you're looking at movement in an injured joint, you don't want to be doing passive movements. It's likely to be painful. Active movement tells you sufficient. So ask the patient to bend the wrist up and down and see if it's restricted. The same with the fingers. Bend the fingers. If that's restricted, it'll tell you where the injury lies. If you are concerned that one of these joints is injured and you want to test the stability of the ligaments, you can simply test whether the fingers are stable laterally, like that.